Hi, we're Team 8, an interdepartmental team comprised of systems, BE, and mechanical engineers, and we have designed IV Sight, which is a device to detect peripheral IV infiltrations. So you might be wondering, what is an infiltration? An infiltration occurs when the catheter is dislodged from the vein, causing fluid to build up in the surrounding tissue. This is a serious issue. Of the 100 million pediatric IVs that are given each year, 20% of them have infiltrations that occur among the patients. These infiltrations can cause serious side effects, including swelling, bruising, and nerve damage, and potential amputations. Our team has designed IV Sight, which is a non-invasive monitor that will take the biological inputs from the patients with our risk assessment algorithm to detect these infiltrations. Our device features three key components. The first is the dual sensor technology. We chose to use both a thermal camera sensor as well as a flex sensor in our device. The second is a line detection algorithm that we wrote in order to detect the line of the IV area. Finally, we have our streamlined dashboard, which we'll show later in the video. Here's a closer look as to how our design was built. We wanted to create something that was reusable, adjustable, and compact. Specifically, we were able to combine the flex sensor, the thermal camera sensor, the 3.5-volt battery, as well as the Arduino Micro into our small device. The device also features a silicone strap that can be adjusted. The image shown here is a smaller version of our device. We wanted something that would meet the comfort levels of the patient, as well as something that could be incorporated into the daily flow of nurses' work. We will now talk more about our testing procedures. We began most of our testing on a pig liver. The thermal camera sensor is used to detect temperature change once the IV is injected into the patient. The dashboard here shows the change in color once the IV is into the patient. We have a line detection algorithm that will show the line of the IV on this dashboard. This is shown, as seen in this video, in blue. We can determine an IV infiltration once we can no longer see this blue line, which shows that liquid has now entered the patient's vein. Here you will see our flex sensor being tested. It will be able to detect when there is a stretch or change in the patient's skin, which is shown in the graph under the sensor. This data will be transferred onto our user dashboard.
The dashboard is designed to be easy to use and easy to read for the nurses. It displays when the patient is at risk of infiltration and when they have most likely undergone infiltration. If the nurse wants to further inspect the data, they can look directly at what the sensors are reading and come to a conclusion themselves. We plan to target three primary markets: ICU prevention, chemotherapy patients, and NICU patients, as they provide the most impact.
IV Sight was well approved by doctors and nurses at CHOP and HUB, and we were able to enter a clinical partnership with some doctors at CHOP. We then went through a technology transfer where we were able to share ideas with these doctors and nurses. A key component of IV Sight is its ability to enhance nurse workflow. We want our device to ultimately serve as an aid to the nurses, giving them another tool to help them with IV infiltration detection. We would like to thank our advisor, Dr. James Wan, as well as all of the nurses and doctors at CHOP that helped us with our design device and implementation throughout the year. We hope that this device will help patients in future years and prevent them from having IV infiltrations. Thank you for watching.